చూసుకోండి.
సైడ్ పెట్టినా అన్నాడు మరి. ఎక్కడ
ఇది ఓపెన్ చేయండి.
ఇదా
స్లైడ్ షో
అంటే మళ్ళీ నేను అనుకుంటా దీన్ని
చేసేయండి. రైట్, చెప్పండి.
అంతేనా?
చెప్పండి.
మినిమైజ్ చేయమన్నాడు. Good morning everyone. By now you must have got the hang of this digital learning. Today I am coming with the topic artificial respiration. Okay, let's start. Artificial respiration is an emergency life-saving procedure. It is done timely and if the technique is proper. On whom this artificial respiration has been done? When the breathing stops but the heart beats. Breathing stops when the heart beats. Artificial respiration. What are the causes? When will there be sudden stoppage of breathing? In case of drowning. What is drowning? Drowning is into the water. When you drown into the water. Choking. Obstruction. When there is obstruction due to smoke of the larynx and trachea. That is choking. Electrocution is electrocution is electric shock. Opiate poisoning. When you know what's opiate poisoning. What is carbon monoxide poisoning? What is strangulation? When you are throttling or compressing the important blood vessels in the neck region. That is strangulation. So in all these cases there will be stoppage of breathing and you need artificial respiration. Stoppage of breathing can be gradual in certain cases. What is that? Poliomyelitis. Poliomyelitis is affected by the virus which affects the part of your nervous system, mainly the spinal cord and the brainstem. Ascending paralysis, it is also called as Guillain-Barré syndrome, where the body's defense mistakenly attacks the part of the nervous. Diphtheria, it is caused by bacteria called Corynebacterium diphtheriae, which will inflame the mucous membrane, forming a false layer, pseudo membrane in front of the tonsil. These are the causes where there will be stoppage of breathing is gradual in these cases. Okay? So what will happen when there is no blood supply to the brain for more than 5 minutes? The tissues of the brain, that is the cerebral cortex, will undergo cerebral hypoxia and it causes irreversible damage. Whatever you do after 5 minutes, your brain is going to be damaged. So you have to do this within 5 minutes before your heart stops. What are the methods of artificial respiration? There are mainly two methods. We can divide them as manual method and the mechanical method. In manual methods, the most common one is mouth-to-mouth respiration. So many methods have been used and they have been discarded, and the one that is even done presently is mouth-to-mouth method, and some other methods are also there. We'll come to it later. What are the mechanical methods? Mechanical methods are the ones where you have to continue for a longer period. Just can't keep on doing mouth-to-mouth respiration for days together. Then you switch on to mechanical method. In mechanical methods, two types are there. One is the tank respirator, the other one is the ventilator. What is the advantage of so many methods have been tried and discarded, but the one even being used even till today is mouth-to-mouth breathing. Why has it got the advantage over the others? Because it can be applied quickly. You need not have any special equipment for that or any aid for that. You can just start then and there itself. That's why it's applied quickly without wasting any time. And it is very simple, anybody can do it, and it is effective. It will give the desired results and it can be applied to all the age groups and it will produce adequate ventilation. So that's what we want. So it will produce adequate ventilation and it works by expansion of the lungs. How is this mouth-to-mouth breathing done? First, the resuscitator should be very swift and alert, and the subject should be in a supine position, and we should clear the airway. Clear the airway means whatever the foreign material is there. Suppose in the case of drowning, you have your weed or some grass, straw, something might be there in your mouth. So you have to remove that with your fingers. Then other foreign artificial dentures might be there. Then there could be some saliva, mucus, blood or vomit, all that has to be cleared. That is clearing the airway. Then you have to draw the tongue forward. Why the tongue should be drawn forward? Because when it falls backward, it will obstruct the airway. It will cause airway obstruction. So tongue should be drawn forward. And the clothes around the neck and the chest region should be loosened. Then in case of if there is continuous bleeding in the mouth or there is lot of vomit which can't be cleared, mouth to nose respiration can be done. And this even in the case of maxillofacial injuries, because we can't put our mouth and cause those injuries more, so mouth to nose respiration is also done in those places. Then positioning of the subject. How do you subject? We have to extend the neck, we have to push the chin up, and we have to put with one hand you push the chin up and with the other hand you press the forehead, and you have to close the nostrils. This is very important because whatever air I am giving to the mouth should not come out through the nostril. Positioning of the subject is very important, that you by extending the neck you lift the chin up and with one hand and with the other hand you press the forehead. And how much, and the subject and the resuscitator should take in a deep breath, that is twice the tidal volume. Tidal volume is about 500 ml. You take twice the amount of the tidal volume, that is 100 ml. Take a deep breath and you seal your mouth with that of the subject's mouth, and you pump and you push you exhale that air and see for the expansion of the chest. You exhale that air and look for the and observe for the expansion of the chest at the same time. Whenever you are exhaling the air, then chest will expand. That is your inspiration. And when you remove your mouth, expiration occurs passively by elastic recoil of the lungs and chest. So inspiration is occurring whenever you are giving the air to the subject, and inspiration is occurring. Inspiration is occurring when you are giving air to the subject, and expiration is occurring when you are removing your mouth from that of the subject. And if air enters the stomach, you just have to press the epigastric region, so that the air which is present in the stomach will bloat the stomach and it will put pressure on the diaphragm, so lungs can't expand. So air which is present in the stomach has to be expelled out by compressing at the epigastric region. Okay. So it has to be done in a supine position, and the next important thing is you have to clear the airway, and the tongue should be drawn forward, the cloth should be loosened, and you have to position the subject. And closing the nostrils is very important, because whatever air we are giving should not come out through the nostrils. And whenever you are taking the twice the amount of the tidal volume and exhaling air into the patient's airway, you observe for the expansion of the chest, that is inspiration is occurring. And when you remove your mouth from that of the subject, expiration is occurring passively by elastic recoil of the lungs and chest. And I told you what has to be done if the air enters the stomach, because little bit of air through the esophagus will definitely enter the stomach, and we have to expel it by putting pressure on the epigastric region so that lungs can expand well. So mouth to mouth respiration, in this inspiration is active because we are giving the air. Inspiration is active and expiration is occurring on its own, is passive, which is physiological, and it is the best method of artificial respiration in newborn baby. The best method when in the newborn baby. So earlier I said it can be given to all age groups. The only disadvantages of this method is in this supine, because as we are doing this in the supine position, water from abdomen, if it is not drained, it will come into the lungs and it might lead to respiratory infection. So during drowning, this is not recommended only because of this reason, because the water can get into the lungs, and this might lead to respiratory infection. So look at this method with the photographs. He is lifting the chin up and compressing the forehead with the other hand, and he is closing the nostrils, and at the same time is sealing the mouth with that of mouth, and he is exhaling the air in the patient's airway. So this is also called exhaled air ventilation. This method is also called exhaled air ventilation. And how much air we are breathing in? Twice the amount of the tidal volume. Okay, importance of artificial respiration. How many times it has to be repeated? It has to be repeated 12 to 16 times per minute, or till the ambulance arrives or is rushed into the nearby hospital. So you have to keep on doing this till some help comes onto the scene. So 12 to 16 times per minute, or the subject is rushed to the hospital. Okay. Next one. The biggest advantage of this is whenever resuscitator is giving the air, his air will have the carbon dioxide. That carbon dioxide in expired air stimulates the respiratory and it will facilitate the breathing. Will facilitate the onset of breathing. So carbon dioxide present in the expired air of the resuscitator stimulates the respiratory center. Biggest advantage of this. And also the expired air of the resuscitator will have 16% of oxygen. We are inhaling about 21% of the oxygen from the atmosphere, but whenever our expired air contains only 16% of the oxygen, because 5% is used for the gaseous exchange of gases in the lungs. So the 16% of oxygen is sufficient to revive the patient. So advantage is 16% of oxygen what our expired air will have enough to revive the patient, and also it will have carbon dioxide in it which will stimulate the respiratory centers. So these are the advantages of this mouth-to-mouth breathing. Next, what are the other methods? Apart from mouth-to-mouth method, there are other methods. Even these are done a little bit differently, but this can be used in case of drowning because these are done in prone position. Okay, first coming to Schaefer's method. Schaefer's method. Two methods are there, Schaefer's method and Holger-Nielsen's method. Now coming to Schaefer's method. Schaefer's method, it's a prone pressure method. Earlier that mouth-to-mouth method was done in supine position, whereas these two methods are done in prone position. So here the resuscitator or the doctor kneels near the patient's waist. He puts the palm on the patient's loin region, abdominal region, loin region. By bending forward, doctor will apply pressure. When he is applying pressure, the abdominal viscera are pushed and they bring about the expiration. When the pressure is put, the abdominal viscera are pushed and they bring about the expiration. Here, expiration is becoming active. Okay. So, when doctor is pressing on lion, expiration takes place. When doctor is bending backward, that means whenever he is removing the hands from that of the subject, when he is not applying any pressure, inspiration is taking place. So when he is putting pressure, expiration is taking place. When he is removing that pressure, inspiration is. So inspiration lasts for 3 seconds and expiration lasts for 2 seconds. How do you time them? This is roughly judged by saying words 1, 2 and 1, 2, 3. So this is the expiration. By just pushing onto the line, expiration is occurring because we are pushing onto your abdominal viscera, bringing about the expiration. Whenever doctor is putting pressure or the resuscitator is putting pressure on the loin region, expiration is occurring. Then when he is removing the hands, inspiration is occurring. He is removing the hands, inspiration is occurring. The main advantage of Schaefer's method is it is done in prone position. So in case of drowning, when there is water from abdomen and lungs can be easily drained. So water from lungs and abdomen can be easily drained because we are doing it in the prone method. So chances of respiratory infection are very less. So this is the main advantage of Schaefer's method over the mouth-to-mouth method, because it is done in a prone position. And the next is, it is a very simple method. It is non-tiring. It can be continued for a long time unless some help arrives. This can be continued for a long time. So if other advantage is, if there are injuries to thorax or back, this method can be used, because we are putting pressure on the loin region. We are not touching the thorax or back region. So if there are injuries to thorax or back, this method can be used. Only disadvantage of this method is that inspiration is passive and expiration is active, which is unphysiological. Usually the other way around, our inspiration is active and expiration is passive. That is physiological. Here the breathing is unphysiological, because inspiration is passive and expiration is active. And the other disadvantage of this method is, if there are injuries of abdomen, this method cannot be applied. If there are injuries, because we are putting pressure on the abdomen and already injuries are there, and you put more pressure, we might damage the viscera. The trauma will increase. So these are the disadvantages. So one is, it is unphysiological method, and the second disadvantage is, if there are injuries to the abdomen, this method cannot be applied. But the biggest advantage is, it can be done in the case of drowning. This is one method. This is the Schaefer's method. Now we are coming to Holger-Nielsen's method. This method, here we are lifting the arms. So this is called arm lift back pressure method. This is also done in prone position. Here the doctor kneels near the patient's head, facing towards him. Doctor will pull his arms up. This will bring about inspiration. Whenever he is pulling the arms up, it will bring about the inspiration. Then doctor or resuscitator will leave his hands on side and put his palms on patient's scapula, and bending forward, he will apply deep pressure on his chest towards the scapular chest region. This will cause expiration. So here both are active. Inspiration, by pulling the arms up, he is bringing about the inspiration, and by putting pressure on the scapular region, he is bringing about the expiration. Here both inspiration and expiration are active. So inspiration for 3 seconds and expiration for 2 seconds. Same way you count 1 to 3 and 1 2. Main advantage of this method is adequate drainage of water from abdomen and thorax. So this is a good method in case of drowning. In case of drowning, this is the best method, and this should be applied, because there is good adequate drainage of water. Okay, and if there are injuries to abdomen, this method can be used, because here we are putting pressure on the thorax region, on the scapular region. So if there are injuries to abdomen, this method can be used. He is bringing doing the inspiration by pulling the arms up. Inspiration is occurring. Active inspiration in Holger-Nielsen method is pulling the arms up, and expiration is doing it by pushing onto the scapular region. By putting pressure on the scapular region, expiration is occurring. So that is the inspiration, and this is the expiration. So both inspiration and expiration are active. So good ventilation is obtained. Only disadvantage of this method is that this is a tiring method, so it needs assistance. With one person, it's very difficult. You can't go on with this method, because you are lifting the arms, then putting them onto the side. Again, you are bending and putting pressure on your scapular region. So it needs assistance. Similarly, if there are injuries of scapula, this method cannot be used, because we are applying pressure there. So this method cannot be used. This is about your Holger-Nielsen method. So now we have seen 3 methods, manual methods. What are they? First one was the mouth-to-mouth method. Second one was the Schaefer's method. Third one was the Holger-Nielsen. Second and third, we can do it in case of drowning. Okay, now coming to mechanical methods. When should these mechanical methods be used? Mechanical methods can be used when we want to, if the subject has to be there in the hospital for a long time because of some other, some lung failure or or something like that, then mechanical methods have to be adopted. Now, there are two types, tank respirators and the ventilator. These tank respirators were used during the earlier outbreak of polio. During the earlier outbreak of polio. These are called iron lung machines. As the name suggests, they are made up of iron or stainless steel. And the subject is pushed into this chamber. It's an airtight chamber made up of iron or steel. And as the subject is pushed into the chamber only with the head outside. And the common one, there are many types of iron lung machines, but the most popular one is this Brinker's method. This was used during polio outbreak in the early 20th century. Okay, and this method will have alternate positive and negative pressure breathing machines. Inside the chamber, there are alternate positive and negative pressure breathing machines which produce periodic inflation and deflation of the lungs. When positive pressure is given, it will produce the inflation. When the pressure is not there, it produces the deflation of the lungs. And now the second one, these are the tank respirators. These are obsolete and they are negative pressure ventilators. Now the second one, which are used even till today, are the ventilators. Here in these ventilators, these are the modern ones, and here in these ventilators, they are called positive pressure ventilators. Here air or oxygen is pumped into the lungs with pressure intermittently through a rubber tube introduced into the patient's trachea. So patient's an endotracheal tube, the tube is passed through the mouth and to the trachea, and that is connected to your oxygen. And inflation occurs when air is pumped, and expiration occurs by elastic recoil of the chest and lungs when it is stopped. So whenever the pressure is going in, inflation occurs, and expiration occurs naturally by elastic recoil of the chest and lungs when the air is stopped. So in this, again, ventilators, two types of ventilators are there. One is the volume ventilator and the other one is the pressure ventilator. Volume ventilator pumps constant volume of air into patient's lungs intermittently with minimum pressure. Intermittently means whenever we are giving inspiration, when the pressure is pumped in, you get inspiration, and when there is no pressure, you get expiration. That is why pressure is pumped into the lungs intermittently with minimum pressure is volume ventilator. And the second one we have is the pressure ventilator. Here it pumps the air intermittently with constant high pressure. Here that's the difference. Volume ventilator, we are pumping the pressure with low volume, minimum pressure. Here in pressure ventilator, we are pumping the air with high pressure. So that is the difference between the volume ventilator and the pressure ventilator. In volume ventilator with minimum pressure, and in pressure ventilator with the maximum pressure is pumped into the patient lungs intermittently. These are the ventilators. See, this is the ventilator. There are two tubes. One is the nasogastric tube. Nasogastric tube means which goes from the patient's nose and into the stomach, and endotracheal tube. It goes from the patient's mouth and into the windpipe. And look at the machine, the mechanical ventilator, which will blow air with increased oxygen through tubes into the patient's airways. So the air from this machine is going. You can see the arrows which are going towards the endotracheal tube and they are entering the lungs, and the expired air is coming out, exhaled air flowing away from the patient. Okay, so inspiration occurs when positive pressure is given, and when the pressure is stopped, expiration occurs. So these are the ventilators. Now what is cardiopulmonary resuscitation? In artificial respiration, I told you when the breathing stops but the heart is beating, you do artificial respiration. Cardiopulmonary resuscitation, here when both your breathing stops and your heart stops, you do the cardiopulmonary resuscitation. So first you should remember ABC. What is A? Airway care. How do you do the airway care? I told you by extending the neck, putting the lifting the chin up and putting the pressure on the forehead, so that your tongue will not fall back into the pharynx. and it will not obstruct the airway obstruction. So next thing is breathing. So breathing is just the same as I have told you how to, you have to seal your mouth with twice the amount of the tidal volume and give the exhaled air into the patient's airway, and you watch for the expansion of the chest. And the third one is cardiac, and whenever you are giving breathing, you also observe for the carotid pulse. If the carotid pulse is there, you continue with the same breathing pattern. Artificial respiration, you keep on giving the artificial respiration. But when there is no carotid pulse, you do the cardiac massage. How do you do the cardiac massage? You just have to put in between the nipples with the fist, interlocked fist, you put the pressure on the sternum. The sternum should go down by 4 to 5 centimeters, and at the rate of 100 massages per minute. 100 massages, you just got a diagram. So you do it at 100 times per minute. And if you want to rotate it with artificial respiration, you give 30 massages and give 2 ventilation. Do 30 massages, cardiac compressions, do it 30 times and give to air ventilation according to the American Heart Association. So that is the way you do it. Okay, see, same thing here. She is lifting, she is closing the nostrils and pumping, exhaling the air into the patient's airway. Air is entering into the patient's lungs, and is look for the expansion of the chest. So these are CPR. The first picture you can see her doing, lifting the, extending the neck by lifting the chin region. She's compressing with the other hand, she's compressing the forehead. Then she is locking the nostrils and blowing air into the patient's airway. And third picture, she's checking for the carotid pulse. When the carotid pulse is not there, she is doing the cardiac compressions. Look how much pressure the pressure should come from the upper body. And how many compressions you should do per minute? 100 compressions. 100 to 120 compressions are done in a minute if you do not want to give artificial respiration. Otherwise, you can do 30 compressions and give 2 ventilation. So here, see, look how she's interlocking her fists and compressing the chest in between the nipples, and look at the pressure coming from her upper body. So this is the way you do CPR. So CPR is done when the breathing and the heart both stop, because if the heart also stops, the blood will not go into the brain, cerebral cortex, and the patient will be brain dead. That is why before the blood stops going to the brain without getting the blood for 5 minutes, it can't survive. So you have to do it quickly to establish blood to the brain. That's it from me.